You've probably never heard of Dr. Kenneth Cooper, but he's had a significant impact on the way we all think of exercise. Take a moment and picture yourself exercising. Chances are you're probably thinking of some form of moderate intensity cardio or aerobic exercise. Jogging, biking, using an elliptical, maybe an exercise class like Zumba. It's called aerobic exercise because your body is burning oxygen to sustain that physical activity. It's a key part of almost every exercise recommendation. And Kenneth Cooper is a big reason why. In fact, he coined the term aerobics back in the 1960s. Cooper was a multi-sport star at the University of Oklahoma, but after med school, he stopped exercising, added 40 pounds, and began to experience heart problems. So he started eating better, started running, and really developed a lifelong passion for the preventive health effects of exercise. He practices what he preaches. He's 95 years old and still exercises 5 days a week. His research with astronauts led him to create the treadmill stress test to measure cardiorespiratory fitness. His 1968 book, Aerobics, became an international bestseller and started a fitness revolution. But Kenneth Cooper is most famous in Brazil, where he helped the national soccer team train for their victorious 1970 World Cup. He became so famous that in Brazil, jogging translates to a Portuguese phrase that's literally doing the Cooper. Health is Wealth is supported by Meridian Health Services and LifeStream Services. Dr. Cooper's advocacy for aerobic exercise actually went against the assumptions of many doctors at the time who thought too much exercise could make your heart muscular and lead to an early death. Even his father, who was a periodontist, believed that. But decades of research have shown quite the opposite is true.
So when we are exercising, our body is doing many things, right? So you're breathing in the oxygen, you're blowing out the carbon dioxide. As we're exercising, and the oxygen is being transported to those muscles, then we're able to make more ATP, which is adenosine triphosphate, and it allows us to be able to get some of that energy.
ATP are like microscopic batteries inside your body, and they need oxygen to release the energy stored inside. And your heart is a crucial part of this process because your blood vessels get the oxygen to your muscles and take the carbon dioxide back out to the lungs. The healthier and stronger your heart is, the more efficiently it can do its job of moving oxygen through your bloodstream. In episode 1 of this season, we talked about the way exercise benefits every part of your body. And your heart is certainly part of that. In fact, if we could take a pill to magically receive all the benefits of exercise, we'd pay a lot of money for that. You may have heard the phrase, exercise is medicine. When people say that, they're usually talking about the preventive effects of exercise. And it's true. To name one example, a study of nearly 10,000 men found that those with good cardiorespiratory fitness had a 4 times lower risk for heart disease compared to those with poor cardiorespiratory fitness. But exercise is medicine is also just as true for people recovering from major diseases and surgeries. If you had major knee surgery, you'd expect to go through rehab with a physical therapist afterward to slowly strengthen your knee to get you back to your daily activities. But did you know the same thing is true for your heart after something like a heart attack or open heart surgery? It's called cardiac rehab, and it's done at a hospital with a clinical exercise physiologist.
It's incredibly important for individuals post-event, post-procedure, cardiac procedure of sorts, even folks that have had heart failure, to engage in a cardiac rehab program. Why? Because it's really helpful for them to be supervised. For some individuals, they may come in and they haven't really done a whole lot of exercise prior to their heart event. Some people could be incredibly fit and still having something that maybe it was in their family history or an abnormal rhythm that popped up. Everybody looks a little bit different, but certainly it's a matter of, okay, is the heart healing? Is it doing what it's supposed to do post-event? And are all the other vital signs acting the way that they should as well?
For For someone who's just come through heart surgery, cardiac rehab starts within the first 24 hours with the inpatient team. It might start with just getting out of bed and walking a few feet down the hospital hallway. It's all about making progress, increasing the exercise little by little, while being closely supervised all the while.
And again, the goal is to be able to be independent when you go home. So being able to, again, do those activities of daily living, be able to get dressed, drive to where you need to go, be able to cook your meals, all those things. And so the goal is to get that heart strong enough and in the rest of your body strong enough in that process to be able to keep that independence for the long term.
And then once the patient is ready to head home, they continue cardiac rehab on the outpatient side, coming back for scheduled visits multiple times a week. The clinical exercise physiologist personalizes an exercise prescription for each patient, but they still monitor vital signs closely to see if at any point they need to cut back a little bit or maybe push a little harder. Cardiac rehab at IU Health Ball Memorial Hospital is a long-time collaboration with the Clinical Exercise Physiology program at Ball State. Graduate students get an entire year of hands-on experience.
The whole second year of that program, we come over as graduate assistants to the hospital. We work with our cardiac, pulmonary, cancer, all of those patients, directly providing that patient care under the supervision of the rest of the team. And so by the time that I had graduated, I'd already been working for a year, basically, treating patients, understanding how to make those goals, assess patient vitals, reading rhythms, kind of getting into the swing of what a regular career in cardiac and pulmonary rehab looks like.
Grace was one of our graduate students here in the clinical exercise physiology program, and she has now taken over the oncology rehab over at the hospital.
Yeah, you heard that right. Oncology rehab. In other words, cancer rehab. Now, when I first heard about cardiac rehab, it made some intuitive sense. Your heart is healing, so you need exercise to strengthen it. But cancer seems pretty different from a heart attack. So for someone battling cancer, why an exercise program?
If you've ever had a loved one or you yourself have gone through cancer treatment, you know that there are a ton of really nasty side effects associated not only with the cancer diagnosis, but also with the treatment of cancer, whether that's chemotherapy, radiation, surgery. There's just so much that goes on in the body. And I tell my patients that while there's almost no body system that goes untouched by cancer and its treatment, there's also no body system that goes untouched by exercise. So we have this tool that can be a really powerful way of balancing the scales and combating some of those side effects.
The schedule of the cancer treatment has a huge impact on the rehab because a patient going through treatment can feel so different from one day to the next.
Every day is a brand new day. So one day they might come in feeling like they're on top of the world, they're ready to hop on the treadmill and get moving. And some days the most they could possibly do is get out of bed and walk to the bathroom. They can't even come into rehab. So on the days that they feel like they can't hardly do anything, or on the days where they come in and they're just not feeling as strong, I feel like my job is to help encourage them to do a safe amount of activity. So we want them to do as much as they're able to do without pushing it to a point where we're going to be then paying for it the next couple days. The days where they're feeling on top of the world, my job is to just kind of be the cheerleader and get really excited with them about, still staying safe and not doing anything that would take us over the top, but getting to support them when they're feeling good.
So maybe you're not healing from a heart condition or fighting cancer, but you're thinking, boy, it would be nice to have someone help me with an exercise plan and cheer me on. Well, if you live near Muncie, you're in luck because the Ball State Adult Physical Fitness Program is the longest running university-based fitness program in the country. And anyone can join.
We have a wide range of ages, anywhere from 24 to 92 years old that come in. And those individuals come in and do a battery of testing in our CEP laboratory, and then a graduate student is assigned to them and writes them an exercise prescription that they're able to follow while they're in our space. None of this is going to happen overnight, which is why we say at least 4 to 6 months later, we're retesting them. We're seeing changes in their cardiorespiratory fitness, which is a huge win because it's the best indicator of our aerobic fitness, our aerobic capacity, again, in helping to lower risk of morbidity and mortality long term. So that's exciting for them. And then they're like, okay, well, I want to stick with this with the guidance of the graduate students within the program.
If you've already got someone supporting you in your healthy habits, share this video with them and say thanks. Join me on the next episode of Health is Wealth as we learn about a Ball State group that's bringing free exercise classes to the Muncie community. Thanks for watching. I'll see you next time.